The FDA has authorized the Pfizer vaccine for 12 to 15-year-olds. A CDC advisory committee will meet tomorrow to discuss the FDA's authorization. And if the CDC director signs off, the first shots could be administered as soon as Thursday. Physician at Stanford Children's Health, Dr. Alok Patel, is here to help us break it all down. Dr. Patel, thanks for being here. You work at a children's hospital, so what's your reaction to this news?
Well, Diana, my first reaction is that this is a great step forward in terms of science and just making sure that as many people out there can be as protected, not only for themselves, but also for everyone around them from a vaccine. Now, I think it's a little bit of a misnomer out there when you hear people constantly saying, well, children themselves do not get severe illness. They don't get hospitalized. Number one, we know they can, maybe at a lesser rate than adults or older people, but also it's important to remember that children can absolutely harbor and transmit the virus. So this is going to be an important step forward in just preventing future outbreaks and getting those young teens back to the lives they miss.
Now, according to a Kaiser Family Foundation poll, roughly 40% of parents who answered with kids 12 to 15 say that they will vaccinate them only if the schools require it, or even then, not at all. So what happens if 40% of kids in this age group don't get vaccinated?
You're giving me early morning anxiety, Diane, but I think that's a realistic number that we need to talk about here. Now, I have a lot of faith in teens and parents when it comes to making the right decisions and having those open dialogues. And we need to remember that vaccine hesitant does not necessarily mean anti-vaccine. We need to switch the dialogue. Vaccine hesitant means people out there have questions. They want to communicate with someone whom they trust. So I hope that after the Advisory Committee on Immunization Practices approves the vaccine, that it's distributed not only to Walgreens and CVS, but also to primary care providers, to community health centers, to pediatricians, so these conversations can happen and we can hopefully get more kids their shots.
So what do you say to these parents who are hesitant about potential long-term effects on kids, given how new this vaccine is?
Well, the first thing we say is that we understand why they have these concerns. I mean, think about the rhetoric that's been thrown around for the past year. We understand and we hear their concerns. We want to have a dialogue with them, but to absolutely trust the fact that this vaccine right now is one of the most studied and looked at biologic drug or vaccines in that class in history. There is so many eyes right now on the development here. There's such an unprecedented collaboration globally from scientists, public health researchers, that we know it's safe and it's working in the real world. We've administered millions of shots thus far since December with no seriously recorded adverse side effects or reason for great concern. So parents should absolutely trust it. But again, feel free to have those conversations with their doctors.
And the CDC Advisory Committee meets tomorrow to discuss the authorization. What are they looking at exactly, and what do you expect them to say?
Well, I expect them to give this a full approval. They'll once again review the data, and then the ACIP committee is going to come out and basically say that we approve this. CDC Director Walensky will then give the green light on it as well, and then it'll be up to states to decide who's going to administer it and when. But one last thing I will just add to parents to remember here is once it's actually approved and states can administer it, parents need to be cognizant of those other catch-up vaccinations and make sure they're having those dialogues with their vaccine provider, because we want to make sure that other shots kids may be behind on are given 2 weeks before or after the Pfizer shot. So just another wrinkle in scheduling, but hopefully it all gets smoothed out and we are headed to a great place into this upcoming school year.
And there are also trials underway for younger kids. So where do those stand?
Well, all three vaccine manufacturers we have right now in the United States, Johnson & Johnson, Moderna, and Pfizer, have trials underway in kids as young as 6 months. Pfizer is expected to submit an emergency use authorization in September for those younger kids aged 2 to 11. And then later towards probably end of Q4, we'll see EUAs for kids as young as 6 months. And so, the important thing to understand here is this is not necessarily going to be the game changer that pushes us over to herd immunity. Herd immunity is still going to take a concerted effort with the adults out there who haven't yet gotten their shots. But I think before we even get there, we'll start to see an inflection point. We'll see cases in this country really start to dip down. But just like we're seeing in other parts of the world, as long as there's pockets of unvaccinated individuals, there's still a potential for outbreaks. Because remember, these crazy variants are just a plane ride away.
So let's dig into this herd immunity part that you just brought up, because over 58% of the U.S. adult population right now has had at least one vaccine dose. So what would it take to reach herd immunity? How many more adults do we need to see? And if kids start getting vaccinated, which it seems like they are, what do we need in that combination to reach herd immunity?
Well, Diane, I think we need to be realistic. People are saying, hey, 12 to 15-year-olds are available to get the vaccine, we'll reach herd immunity. That's only 5% of the population in the United States. And you mentioned 58% have had one shot. Before earlier, we were talking about getting herd immunity from vaccines. These numbers have been thrown out between 70 and 85% vaccinated. But we have to consider the fact that there's a lot of people out there who may have some form of natural immunity from having COVID in the past. So we may actually start to see the effects of herd immunity starting at around 50 to 60% fully vaccinated. And some may argue we're seeing it right now. But the hard part to really reconcile, is it just from vaccines, or is it also a combination of everything, including the travel restrictions, masks, businesses being shut down, physical distancing, all these other factors that, frankly, we're really tired of. And so it's important that we just keep heading towards herd immunity, but we're realistic about the fact that we may not actually get there from vaccines alone. We may see resurgences this winter. So people just need to be realistic yet optimistic about the direction we're going in.
All right. Realistic yet optimistic. That's the phrase of the day. Dr. Lok Patel, thanks for that.
I'm going to put that on all my cards from now on.
You should.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.